Good morning. Happy Friday. This is Amy with 100 Plus Abandoned Dogs of Everglades, Florida, and Chewy. Yay! We have poopies. Good boy, Chewy. Good boy. I wanted to do a little update this morning because everybody was asking how Chewy was doing after his diagnosis. So here we are. Chewy just had his breakfast and his meds. For any of you that are new, welcome. We are a 501c3. We rescued Chewy from the Miami-Dade shelter after receiving an urgent plea that he was going to be euthanized. He was in horrific shape. We had no idea what we were walking into. Hi, baby. His eye is starting to heal. That is from an abscess in his mouth. Looks worse than it is. His entire facial, nasal, and structure is basically detached from his face. He is not a candidate for surgery. We have tried to go that route, but unfortunately, all the odds are against Chewy. So he is a permanent feeding tube baby. All of his food is given to him by a tube around in his neck right there. That is a wrap around his neck to keep the tube in place. He gets fed 4 feedings a day, and his meds are also administered through the tube. Recently, he was in the emergency hospital. Such a fighter. He was basically had an increased urinating, decreased appetite. He had a sore under his eye. So we brought him into the emergency hospital where he spent a couple of days. They changed out his tube and gave him a new feeding tube, and they did all of his blood work. They also did an exam. They found that he came back positive for cancer. So every day is going to be a gift for him until he tells us, come on, watch your face, honey, over here. Every day is going to be a gift for Chewy until he tells us otherwise. He's happy. He loves love. Oh man, we got dirty. Look at that. Oh boy. Yuck. Let's take those off for now. Come on, Choo Choo. Come on, baby. It's starting to get a little drizzly outside, so it's going to be a yucky day. But Chewy is a fighter, guys. He's a fighter. We committed to him when we pulled him from the shelter, so of course, all the ongoing medical that we have for him, that's what we do. It's not cheap. Constantly in and out of the hospital. Like I said, recently we had him there, and our bill was $3,000 that we never even recovered from. Come on, baby. Come with me. Come on. Come on. Choo-choo. Come on. Taking a detour? Are you taking a detour? We don't really know how old he is. He could be 6 to 10. We don't know. It's hard to tell. But he has had he was dealt such a horrible hand in life. It's so unfair. But for whatever it is. And we have pulled him out of that shelter 7-8 months ago. We've had him. Nobody's stepping up to give him a home. Nobody wants to deal with feedings through a tube. Now that he was just diagnosed with cancer recently. So, our hearts are sad. We are so sad about the situation. We love him. But we're going to give him the quality every day. So it's a big responsibility, but that's what we do. And when we rescue these dogs, like I said, we just don't know, guys, when we walk into these shelters and we pick up these dogs that are basically on death's door, in danger of being euthanized. So when we rescue them and we take them into our rescue, this is what happens. But when we commit, we commit. We weren't going to put a needle in him if he's not suffering. If whatever he needed, medical, he receives. And as you've seen us with his journey for 7-8 months, maybe even a little bit longer, I think it was July or August that we pulled him. He's just checking out the bathroom. I'm just following him around. So he recently got a nice groom, got all that hair trimmed down, makes it a lot easier to keep him clean. What you doing, Shoo? You checking everything out? You like the smells of all the rugs? He's so sweet. He's such a sweet, sweet baby. I'm sorry, Joyce. I'm so sorry about your Vinny. We lost our Brody too and our Maggie a few years back. It's cancer, cancer, cancer. Sorry you're looking at a toilet, but Chewy has chosen to be in the bathroom. So this is where I am. I know we wanted so much more for him. We were willing to do that massive surgery with his nasal so he could breathe like a normal dog and eat like a normal dog. But unfortunately, it wasn't in the cards for him. He's not a candidate. He can't now with cancer. He can't go under any kind of surgery. So just one day at a time, until he tells us otherwise. Isn't that all we all have, really? One day at a time. Chewy! What are you doing, buddy? Hi. Hi, handsome. Hi. Come here, babes. All right, do what you want. Check out all the toys. I'm sorry, Kathy, for your loss. I'm so sorry. It's paralyzing. I know. I mean, when we lost our Brody, and it was back in December. I'm still like January, February, March. I mean, I'm just like still, Carol and I took in little Ricky, no, don't you pee there. You just were outside. Don't you do it. Normally we have a belly wrap on him, but we're giving him a break from that during the day, and we put it on at night. Come on, Chewy, in here. This is your big space. Come on, bud. This is Chewy's area, so he's comfortable. Come on, buddy. Good morning, Roxanne. How are you? I know there's so much loss and so much sadness with all our babies. Joanne, thank you for asking. Everybody is getting better. They're all on medications. Come here, sweetheart. Oh, we just made a big poopy. We tried to pee in the kitchen. I have to go clean that up, Choo-Choo. There you go, buddy. Everybody's on their medications. I just administered everybody's meds with their breakfasts, so that's done. And the coughing is definitely subsiding. Hold on one second. I just want to put this pin in this pen while I have... Okay. Hi, everybody. Good morning. Yeah, so everybody's been taking... everybody's been taking their medications. Basically, it's, doxy and prednisone and different antibiotic for different dogs. So this is the station where we basically get all their meds together and prepare all their breakfasts and all that. So that's what I did this morning. Everybody got all their meds. They were all great. Little coughing here and there, but it's getting better. Shelly had the bulk of it when it started. Shelly and Keith. Wolfie started. Hi, babes. Hi, Woo. Come here. He doesn't want to get up. He doesn't want to go out. He's very, very comfortable in his bed, but he started coughing. So he's on antibiotics. Vaughn is in the clear, knock wood. Sam, Sue, and Blake are in the clear. Harper is doing amazing. A slight little cough once in a while, but she's done with all of her meds. She's doing amazing. Everybody else has it. Well, I'm sorry, that's not true. Blackie, the Muppets, the three Muppets. Blackie has a slight cough. Poppy and Snowflake do not, but everybody's been started on. What are you doing, Woo-Woo? What are you doing, bud? I just trimmed around his face. But he's you want to go out? You want to go pee-pee? Come on, let's go. You ready now? Okay, shut the light. Let's go outside and go pee-pee. Come on, I'm coming. Let's go. Good boy. Come on. Come on, let me get my dirty shoes on. Look at my shoes I took in from the outside. Whoa, come on. Let's go. Good job. Let's go pee. So yeah, everybody's, basically on their antibiotics, hopefully on the mend, in the right direction, definitely seeing that they are. We keep a good eye on them. They all wanted They didn't want to eat because they weren't feeling well, so we bought a big roll of Fresh Pet, and that seems to be working. It's easy to make little balls for their medications, so they're enjoying their Fresh Pet. I'm just going to turn this volume down because I can't. Got TVs going everywhere. Yeah, it's really tough when, you know, when the dogs come down with the cough, the kennel cough, and all the things they pick up from the shelters. It's extremely stressful. I mean, there's nothing worse. Like I said in my video last night, there's just nothing more stressful than watching your babies, you know, not feel well. So, Fresh Pet is awesome, Cindy. That's the only thing little Ricky will eat. Actually, I cooked up some ground beef, lean ground beef, and he devoured it. That's his new favorite. But yeah, that's all that little Ricky will eat is Fresh Pet or ground beef. Good morning, Cassandra. How are you? Happy Friday. I picked up all the dirt from outside when I was following Chewy around in the grass. It's a little wet. It's not raining, it's just sprinkling. Good morning, Pauline. Happy Friday to you. How are you, Pauline? No complaints? I can't. No complaints here. I can't complain. Life is pretty good. Live and kicking. That's what matters most, right? Good morning, Sabrina. Good morning. Woofy, where you going? I'm following you around. I just did a throwback, guys. A video number 17. No complaints. I love to hear it. Glad to hear it. Good to hear it, Cassandra. I did a throwback video just a few minutes ago of our dog, Stevie, a black little pitty that was brought in by a wonderful police officer, Stephen Kraft, back in 2014. His new name is George now, and he was adopted and living a wonderful life with his mommy, Lindsay. So that's our throwback video of 2014 on video number 17. As I stated, I would be doing a video here and there. I was doing them every day. Good morning, Daisy and Robert. Good job. Everybody's pooping in the same spot. I'm going to be going to pick up Poopy soon. Good boy. Get it out. Yay! You're so proud. Do you love the videos? They're pretty cool, right, Pamela? I know. Me too, Cindy. Yeah, so I put up a good one. It definitely restores your faith in humanity, such as a police officer. I remember him so well. And that was 2014, a decade ago. Wow, wow, wow. Decade is a decade. Good job. Come on. All right. Nice. Let's go back in. Let's go chill back in bed. It's a good day to stay in bed and watch TV. What are you watching? Huh? Yeah, see, here he goes, a little coughing. Okay, you're fine. I'll be right back. But, I'll wash my hands. Trying to wash. Spray. I know. I'm sorry you're watching me wash my hands right now. Then I'll do a little Lysol spray. Somebody was like, Lysol doesn't work. Lysol does work. Lysol bacteria works and Lysol spray works. It works for us. It always has over the years with going through all this kennel cough stuff. It's not our first time, believe me. Hi, Vivian. Good morning. How are you? Good morning. I was thinking about little Dex. Dexter and Dory, I know. I think about them all the time. They are living the best life with mommy and daddy. And we did a follow-up video. Shelly and I went to visit them after they got adopted, and it was so awesome. They're doing great. They are. They're so happy. Spoiled rotten, as it should be. Is that what you were referring to? Yeah. Where's my Lysol? We're just doing a lot of laundry here, a lot of washing of everything and wiping and spraying and It's my new perfume. Lysol is definitely my new perfume this week, for sure. Thank you, guys. Thank you. Thank you so much for your kind words. Appreciate it. Let's see if we can get... You ready? Come on. Let's go. Good boy. Come on. Come on. Good boy. Bonnie. This is Vaughn's third time out. I had him out. Let me just... Sorry, hold on. Gage and Godiva are great. They're great. Yeah, we get updates on our babies. You know, we don't hear from them every day or every week, but we get updates on our babies. And if we're thinking about them, or, you know, we want to know how they are, we always reach out. One of us always does, and just to see how they are. But you're talking, it started this rescue in 2011, 12. And then you're talking 13 years of over 5,000 dogs. So we try to keep up with as many as we possibly can. Yeah, it's a little drizzly here, not terrible. So we try to keep up with our adopters. We do have a database we pay for every month, $45. It's called Tracker Beast, and it keeps track of all of our adopters' names and phone numbers and address and who they adopted and when, and medical and their microchip numbers. So we have all of that on hand, which is really comes in handy. Good boy, Vaughn. Doing your yoga. I remember them. Bless this man. I can't remember his name. Who are you talking about, Suzanne? I don't know who you're talking about. Are you talking about a specific dog? There's so many dogs. Yes, you did, Pauline. I know. I'm so happy they finally got into a home. Good morning, Anna Baker. Yeah, Gage and Godiva, they were with us for a long time. They were years. Ridiculous. Good morning, Tammy King. Good morning. Wilbur's outside. I don't know what he's doing right now. He could be laying down. Let's see. Let me see. Let's check it out and see where he is. He is nowhere to be found, so he's probably... He had his breakfast. He left one strawberry. Oh my God, he's so funny. Look at this. He left some of his lettuce, romaine lettuce, and one strawberry. Maybe he's saving it for a snack. I can't. He's probably in the back behind the she shed. That's where he likes to root. And there's a big tent back there, so sometimes he lays back there. I'm just whispering because I don't want to make him run up here and thinking, you know, he's getting fed again because he just had a massive breakfast. But nope, he's in the back somewhere. He's doing his thing. I see you. Come on. Did you poopy yet? Did you do your poopies? Yeah, snack for later. Hi. Good morning, handsome. Good morning. Good morning, you gorgeous boy. You're so gorgeous. Take your time. Take your time. Oh, you got the deer antler. Okay. He just took the deer antler. That was Susie. Susie brought that deer antler. What are you going to do with it? You going to chew on it, or are you going to try to... Don't bury. No digging. He's so magnificent. He's so majestic. You want to bring that in with you? You can. You have 20 in your room. Oh, it's so peaceful. I can hear the birds chirping. The roosters were roostering this morning early. It's so peaceful and quiet out here. It's so nice. Prinny's great. Thank you, Sophie. Yeah, I checked in with Shelly late yesterday when they were leaving to go on their little break, and Prinny was good. So knock wood, it stays that way. She had the kennel cough prior, so, but she's in the clear right now, and so is Vaughn, because he had it terrible. Oh, good. Gonna finish watching you all. Then it's coffee time, girl. I'm going on my second cup. Mario's good. He's good. He's gonna be having his surgery. I just spoke to Tiffany. I'm just waiting on a plan and a date. So it's either gonna be this week or next week, and it has to be, I think she said 14 days after his treatment. So it's in between. Come on. I know. Quiet is everything, right, Pauline? The birds are chirping. It's just so beautiful. Do you hear the birdies, Vaughn? Vaughn, do you hear the birdies? Do you hear the birdies? And sweet face. The best boy. Yes, you are. Cleaned her eyes. Cleaned her eyes in the mornings. Binky's good. He was out. He ate his entire breakfast. Again, Fresh Pet was a winner. It has to be 14 days after one of his treatments. About a month from now, possibly. Tiffany's on here about Mario. She saw the comment. Thanks, Tiff. So, yeah, that's the plan for Mario. It's time for another cup of coffee. Mightn't even finish. It's cold. You ready? Come on, let's go. Oh, don't you even start that. Did you just make a noise? Every time I hear a noise, I'm like, uh-oh. You all right? God's country. You got that, Pamela. It certainly is. Certainly is. I even threw my flip-flops in the washing machine last night. If you guys could have seen me when I left here after covering the house. Oh, I already got your bowl. Okay, go lay down and watch TV and I'll be back, okay? So I came here when Shelly and Keith left. They left around 5-ish. So I came over here and took over and stayed till like 9:30-ish. So, I was with all the dogs, the coughing and the sneezing. And I was like, I don't want to go home to Ricky and Diamond and bring it home. So I literally took my clothes off, which are still sitting on the chair, wrapped myself in a big towel, walked over in a towel, and literally went right into the shower and scrubbed my hair and scrubbed up and cleaned up, so I didn't bring it home. And that's what I have to do. Because Ricky's like 13, 14, and I don't want him to be compromised. I really don't. I don't want any of these dogs to be compromised. It just always makes us a little more nervous when the dogs are older, It's harder, or if they have, some sort of a medical condition. So with that being said, yeah, it's just, I want to keep it out of my house. And Diamond's 11, so I just don't want any of them. Nobody wants their dogs to get sick, And that's why I even told Tiffany, I'm like, and Darla, that cover the big dogs down in the detached, I'm like, listen, guys, there is absolutely no reason why. Do you want to come out, honey? There's absolutely no reason why Sam, Sue, and Blake have to come up here to the main yard, because it's in the yard. They pick it up. They have their own yards. They have their own beautiful space. There's somebody with them all day, from 7:30 to 3:30. They're never alone between whoever's there that day. There's always somebody here, 6 days out of the 7. Good morning, Maria. And I don't want them coming up here while we're battling this. So once we're past it, then they can come up and, get the big yard. They are lucky to have us, Lynn. I must agree. I must agree. I have to tell you, I'm very leery about other rescues that I don't know about. There's a few rescues that I've worked with over the years that I love and respect. They do everything right. So come here, Mama. Let's go this way. Come outside. They do, everything pretty much by the book, how it should be, as far as rescues, doing home checks, inspections, background checks, meet and greets, everything in person. So when I got done doing my video and updating all of you last night, I got a call back from the Boston Terrier Rescue. Her name was Betty. What a lovely, lovely, lovely woman. Man, we spoke for almost an hour. And just, you know, we everything we do is the same. It was so refreshing. It was so wonderful. And I told her, you know, I'm really worried about Goofy. It didn't work out. So the people that took Goofy yesterday brought him back last night. I spoke with the owner, and I told them, you have to get Goofy into the Boston Terrier Rescue. They don't board, they don't kennel. They go directly into an experienced foster, and they stay a minimum of 2 weeks in the foster while they get their vetting, their neuters. They return back to the foster while they're recovering, like we do here. You know, they're not sitting in kennels, they're not sitting in a vet's office and boarding. So I felt really, really comfortable and really, really good. I'll just take this off me while I'm talking to you so you can see Miss Harper enjoying herself. But yeah, so, you know, she explained to me how their protocol and their process is. So I immediately got on the phone with the owner, and he said, thank you so much, Amy. I can tell that you are so passionate. We so appreciate all your help. And I said, please don't miss this opportunity. So the head of the rescue, or the intake person, Betty, had sent me a text after we hung up, after an hour conversation, and she was like, I got the owner's surrender form, Amy, we're good to go, everything's good. I'm like, oh, thank God, I can sleep now. So Goofy is all set. He's going to go to an experienced Boston Terrier Rescue in South Florida. They do not ship, they do not transport, nothing. So he's going to be going straight into a foster home, and he'll get everything he needs until they find him the perfect forever home. So, phew, I can breathe. Because once I say yes that I'll help a dog, whether it's even just a courtesy post, I get so invested. And I never even met the dog. I just get so invested. I feel like it's on me. Hi, Yanira. Harper is very happy. Very, very. Are you happy? Are you happy? Yeah? What? What? I go get you. Don't fall off that couch. I go get you. I go get Harper. I gonna get you. I gonna get that belly. I got the belly. I got the belly, mommy. Oh, look at the belly. Look at that belly. I love you. I love you. You're just the best girl. No, I can't tell you. Like, this is a therapy dog. This is an emotional support therapy dog. She is by far, like, one of the best dogs we've ever touched. I mean it. I mean it. She's perfection in every way. She's not a barker. She's not destructive. She's never had an accident. She's a lover. She's submissive. She's so grateful. There's just like, I can't explain it to you. I cannot. And she came from the worst condition, the worst environment of abuse and neglect and, you know, just not cared for, matted and infested with fleas and just so unkept and so unloved. And just to see this baby girl in just a couple of weeks come to life and she's just so appreciative for everything. Mommy, did you go outside? I don't think we went outside after I just took you out of your pen. Yeah, she's 3 years old and she's 19 pounds. She's beautiful. I should have kept you. I should have. Because you're so beautiful and so sweet. So perfect. But I have little Ricky and he's a lot. He's very needy. Yes, he is. I'm in love too. Oh. I'm so in love with you. I'm so in love with you. Look at her. Have you ever seen a dog, like, not many dogs stare you straight in the eye and don't turn away? She's just, therapy. You know, I see her going, like, she would be so good at going to nursing homes, like a therapy dog. I know. All right, guys, I got to get my morning going because Carol's calling me. It's time for me to go take care of little Ricky because she's going to work. So I'm going to be going back and forth because I'm not bringing him over here. I don't want him to get sick. So that's where I'm at. I will be back later. I just wanted to say good morning and show you Chewy because everybody was asking and update everybody. But I'll be back later. Enjoy this beautiful, beautiful Friday, whatever you're going to do. Have a wonderful day. Go check out the video I shared this morning. And again, there is a donate button on here. Please, please consider making a donation to help us because we do have a lot of outstanding medical and we really could use the help. I mean, even if it's $5, let's do a $5 challenge. Later, Sophie. Thank you in advance for your love and ongoing support to allow us to continue to take care of all these babies that we have committed to. When we commit, you commit. Because you guys are like, Amy, can you get this dog? Amy, can you get this dog? We're here to do the work and keep it going, but it's more than that. So we need your constant. Yes, Roxanne, we received it. Thank you so much for your donation last night. So appreciate you. I think there were like 300 people watching that video last night, and I think 8 people donated. We can do better. I'm sorry, we can. Even if it's, I don't care if everybody donates $2. I don't care, it adds up. So please consider making even a small contribution. Again, happy Friday, everybody, and I'll see you later. Have a good one.